who is ready to define for us? Or Omona?
Yes. Good afternoon, doctor. Health is a state of being physically, mentally, socially, being free of infirmity.
Okay, good. What about systems? Evelyn, atukunzire, what's a system? Evelyn, are you there? We always talk that word. I like that system. What is a system? I'm not able to hear. Evelyn, your network is poor.
No.
I didn't hear what you're saying. Your network is breaking. Maybe Sharon can help you. Sharon Abuja. What's a system? Okay. Byarugahara. What's a system? We use this word commonly. It's a system, a system. I like that system. What's a system?
Yes, please. Good afternoon, doctor. A system is I'm looking at, it's like some, let me say, it's working together, different bringing up different things working together to meet up a goal.
Alonda, Stewart.
Hello, excuse me.
Yes, what's the system?
System, unorganized state of something.
I don't know whether it is my network, but your network is equally poor. We can't hear you. So now when you say a healthy system, let us combine the words now. Tugashawa. So when we say healthy system, what does that mean now?
Are you asking to Kashava or Shava?
Kotias. I'm asking Kotias. Okay, maybe Chirumira can help us. Because now.
Can you hear me? I'm talking.
Yes, yes, I can hear you now.
Okay, so a health system could be an institution or an organization of people or resources that are pulled together to meet the needs of either the targeted population or maybe a targeted program. Like a systematic way of meeting people's needs or program needs. It could be people, it could be an institution, it could be in terms of resources that will deliver health care.
Okay. So that is it. We're looking at organizations, institutions, and healthcare whose primary purpose is to improve health. Primary purpose, those vehicles, houses, truck infrastructure, ambulances, and their entire primary role is to improve health. That's what we call a health system. And of course, this includes the money, the funds, the supplies, the transport, anything that works together. So the money you have in your pocket, it is part of the health system. When the child is sick, you contribute that money, take the child to the hospital. So it's part of the health system. So then, what about now health systems research? So what then is health systems research? Esther S. Somebody called Esther S has landed here. Esther S, how are you? Are you the true Esther or the other Esther who is a ghost? Okay, to see me, Kenneth, maybe you can save us. How do we now define, now that we know what health is, we know what the health system is, then what is health systems research? Hey people, are you there? Are you hearing? Is it my network that is bad? Oh, the breakfast has clogged everything. Roy, are you able to hear me?
Yes, I'm getting you. We are getting you, sir.
I can hear you.
So how come when I say are you able to hear me, the network is okay?
Okay, me,
Now,
sir, I will understand it as it's a way of trying to understand and improve how societies organize themselves in achieving a proper healthcare system.
Okay. Any other five?
Or as you can say, maybe, or we could say, it's maybe multidisciplinary.
Yes, please.
Let's first hear from
Yes,
Roy,
as he has started.
Roy, continue then, Asiki.
Hello.
Yes, go ahead.
Yes, health system research looks at multidisciplinary fields, of course, in a sense that it examines how people get access to healthcare services, in terms also finding the cost of those, the cost of the care, and at the end, what the benefit or what is the result of the care that person has benefited. That is briefly what I can say.
So in health systems research, we're saying it is a multidisciplinary field of scientific inquiry, where we are looking at so many factors: social, financing, organizational, technology, people's behavior, access to care, quality of care, so many things. And the ultimate goal is to understand or improve the health of the population. So other definitions say that it's a study of the means by which biological, sociomedical, and other knowledge is brought to bear the health of communities under a given set of conditions. So we want to conduct research on a number of things that happen within the health system in particular conditions, either under controlled conditions or uncontrolled conditions. And so there are two things here, health systems research and health services research. Now, after this, you may want to go to do a master's in material on health services research. So the health system now goes beyond the boundaries of health services. Like I said, the health system starts from home. If you have a bicycle at home and the neighbor is sick and they come and borrow, that bicycle can constitute the health system because it is easing, helping somebody to gain back life, provided within the system. Quacks, then nursing assistants, then you come to the other practitioners. All these things that occur that are able to influence health, including the roads, you know? So the objective of HSR at all levels, of course, is to provide managers with relevant information to make decisions. Remember, from the definition of research, we said the ultimate goal is to make decisions, and not just decisions, informed decisions, And these decisions, we need them to improve the functioning of the entire system. It can be in the matters of nutrition, matters of family planning, matters of child health, maternal and child health, adolescent girls and young women, and the likes. So the ultimate purpose here is to improve decision making. Of course, we want to make decisions to solve problems. And we know how our health system has a number of problems. And of course, the issue here is to improve health of people through improvement of various components of the health system. Yeah, there are components of the health system, and most of them are interrelated. That you can provide ambulances, but if the roads are bad, the ambulances won't work. You can provide, you can build infrastructure, have hospital buildings, but if there is no medicine in the hospitals, it won't work. You can build hospitals, provide medicines, but if the health workers are running away, it won't work. So there are all these different components. There should be means of enhancing the efficiency and effectiveness. And when you enhance, say, the capacity of the health workers, then the health system in itself has becomes efficient and effective. Then, of course, we find that a lot of research is being done. Conventional research, but some of this information is not implemented, or it is poorly implemented. So if something has worked very well in Kenya, it may not guarantee that it will perform very well in Uganda once applied in Uganda. And so we may need to do systems analysis or analyze the applicability of these ideas or information in Uganda. So we need to do research such that we get information that help us to plan, allocate resources, design systems, design programs, strategic plans that are able to improve the health of the society. And so when we talk about health systems research, we are looking at cultural things, political events, historical factors, the demography or demographics, looking at the epidemiological trends, we look at the environment, the geographical location, socioeconomic factors. In the days when they were buying bicycle ambulances, the motorbike ambulances and bicycle ambulances and supplying them. So they bought bicycle ambulances and supplied them to the entire country. But did they work in Kisoro? No. Did they work in Kapshorwa? No. But they were only able to work in flatter areas. So geographical events can affect the geographical events, all factors can affect the health system. Looking at the environment as well here, and the location where people live, where people stay. If you're looking at people in the landing sites, for example, you expect to have high cases of HIV in these areas. Now, culture. We have varying cultures ranging from the Batwa to the Karamojong and to the others, you know, and all this, the way people behave and believe has an effect in the health system. You know, you will go and work in areas where people behave in a certain or act in a certain way. You must understand that. Now, where have we come from? Where has the health system come from? You know, from the construction of the Obote hospitals. How many hospitals have added? How many more do we need vis-a-vis the population? And even when they have constructed, what is in the hospitals? Epidemiological trends, you're seeing diseases emerging and re-emerging diseases occurring in our society. So we need to also know this. And so when we're designing interventions, we want to see whether these interventions are able to be applied in our health system with respect to these factors: cultural, socioeconomic, political, epidemiological, demographic, geographical, and environmental factors. And so we will assess and see whether these interventions will have covering. Will the people accept them? Are they cost effective? Are they cost efficient? Are they equitable? You know, who are the risk groups? Which people will use them? And then, of course, looking at the socioeconomic events here, that time when we're giving out mosquito nets, you know, people in Kampala here, in Kamocha, people were lining to pick mosquito nets. But in some areas in Munyonyo, you would move with the mosquito nets and people come from somewhere. And you know, the door-to-door campaigns of immunization. You know, when you go to Katanga, you get people readily available. But if you went to these highly fenced areas, you have to know, you will knock on somebody's door until the scary refuses to open for you. So there are issues of health of the environment, of our historical lineage and whatever that affects health. So when we're now talking about health systems research, we want to conduct research on all these things. What policies are in place? How are the taxes? How is the fuel, for example, right now? How is fuel affecting the health system? You know, so we can have a discussion and say, you know, whereas the price of fuel is increasing, but even the increase in the price of soap has an effect in the health system. And we know the value of soap. Are the people not using soap for washing their hands and washing their clothes? They are not using soap. That means there's going to be an increase in diarrheal diseases. All these diseases associated with hygiene are going to increase, and all that will impact the health system. So whatever happens outside the health system may not necessarily, its effect may not necessarily remain out there, but it will come and affect all of us. So in Uganda, let us discuss what are the current challenges with our health systems. Because we know that this is not confined to only poor countries, even other countries. I want to open the discussion for the next 10 minutes. You have your Ugandan. What is it that is affecting our health system? Let us start with Abraham. Aye. You haven't talked for morning.
Good afternoon, sir.
Yes.
I can say the problem with the health system in Uganda is like in some areas where it's a lack of awareness, because in some areas like Karamoja and those northern Uganda districts, there are some other villages that the health system or the health awareness is not reached, whereby what happened in in Mount Elegant, where Mugishas, or how do you say, these people that are living around that mountain, practicing the whatever circumcision, which is oftenly by just using one razor blade to circumcise so many things that can even for someone which has been affected by a certain virus. So I'm seeing that has one of the problem that is facing our health system in Uganda, because health awareness is not that much rich in some areas. Yes. Hello.
Yeah, we can hear you.
Yes,
we can hear you.
And also about whatever infrastructure, because there's some areas that is hard for for health personnel to reach a certain area because of poor road construction. So it's one of the reasons as to why health system also has a problem in here in Uganda. Yes, sir. Hello.
Atukuzire, can you tell us what is happening in the West? What challenges are you experiencing in the Western Uganda health systems?
I think it's that are put where they're not, that are given to those who actually have.
Come
and
again.
Then those that don't have are left insurance.
Insurance, yeah, okay.
Usually the people who are under insurance are those that are actually well off. They can actually afford to access health care, but they're even still favored because they're uninsured. Then you realize someone who is good to pay for their own health care.
Okay, thank you.
So it brings a little bit revolves management and the systems, management of health systems.
Hello?
Yes, Omona.
Yeah, I wanted also to contribute.
Please go ahead.
One of the factors actually contributing to poor health system in Karamoja is the insecurity. And you will find that some of the families who are, Karamoja rely on livestock. So it is the very livestock that they sell and they use for acquiring proper medication from various health facilities. So you realize that the family which have lost livestock, they become actually poor and they cannot be able to support themselves. Therefore, you'll find that these are the people who are going to suffer. And for them, because they don't have anything to support themselves for. This is one of the factors that needs that contributes to the failure of the health system in Karamoja. Thank you.
All right, thank you.
Excuse me, sir.
Yes, please.
I'd look at the problem of finance. you're looking at a country whose population is growing at a high rate, but the allocation to the health sector is being stagnant. And on top of that, not even reaching to the standard. Like, for example, as per the Abuja Declaration, requesting each country to contribute at least 15% of its budget allocation to the health sector. We find that Uganda is around 7 to 8, they're not even reaching 15. So you see a very big gap and the actual deficit in the services being needed. Then the other thing is look at the corruption. Even the little that is allocated there, the level of embezzlement is very high to the extent that even it can't be inspiration to do the little it is supposed to do. So look at the corruption from the up to the bottom. That is even to the staffs and so on. Then you look at the medicines and technology. So we look at health centers spending like 3 months without new stock. The red level of out of stock is very much. Yet remember, sickness cannot wait for the 3 months. So the drugs are very few. Then the technology, something that should be done in a simple way. We find it very hard because we lack the technology to simplify it. Then we look at the human resource. Now we find the patient-doctor relationship is very low, plus the nurse and everyone. So you find that doctor working with so many people can't even finish. They end up doing the next. They have to next. Then look at the informatics, the information, how we store our data is very poor. We are still using the hard copies. Countries are now using technology, inserting computers and so on. They're using systems that are software. For us, we are still on the writing of the patient's names down. So look at even people coming for follow-up series right again. When he goes to another hospital, you again carry again more history. But if I feel that information is kept very well, even accessible to whichever health facility someone can access, it will be very simple. Then look at the facilities. The health centers, they are very few as far each parish should be having at least one health center, 2. We find that many parishes are lacking 5 of them having 1. So we also have that deficit. Thank you very much.
Okay. So thank you so much. So the health systems, we eventually find that there is now growing research and recognition for conducting research in the health systems. Of late, you had the government of Uganda get involved, giving 30 billion shillings to Makerere University to conduct research. So such things show us that, yes, the government is recognizing, other partners are recognizing that there is need to conduct research in the health systems, because this is what shapes the decisions that are made. We have now governance, we have structures, we have institutions that are working or are seeking to achieve the national health objectives. And so we need to do research. There's now financing to ensure that the adequate funding is available at the right financial incentives are available in place. How shall we know that the universal health insurance thing that is coming, social insurance,